has remained at that number. But there's good news because to address maternal deaths, we had to provide something from the Department of Health. We wanted mothers to deliver at health facilities, not at home where the risk is higher. And so in 2010, when it was 74% of mothers who deliver at facility day in health facilities, it's now up to 84%.
Great, that's good news. I mean, that's the traditional way, right? We used to deliver at home with the midwives.
And the good news is many of them, now at 88%, are delivered by skilled birth attendants. But of course, we want it to be higher, 90%. But there's a reason why this happens. There are three delays. May I explain to the audience the three delays that that we have to address? The first delay is for mothers to seek care. The health-seeking behavior is important at this first delay. So if there's a delay, then mothers do not have the information that their pregnancy, they're in trouble, and so therefore they don't know, and help cannot happen at any time during their pregnancy. Now, the second delay, even if they know the information, they have to reach a health facility. That's access. So that's the second delay. We have problems in transportation. We have heard stories of mothers being brought to health facilities in different types of vehicles. Sometimes they walk, and that's the sad part. The third delay is, even if they reach the health facilities, services are still not offered. Maybe there's no doctor, maybe there's no anesthesiologist, maybe there's no blood, because oftentimes it's blood that's needed. And so this is the reason why the Department of Health worked with local governments, the private sector, so that we can address the three delays. There's good news, there's bad news, and the same story repeats itself, and we hope we can change that.
Thank you. Yes, definitely. I've heard stories of people giving birth even on the road, on the way to the hospital, or even worse, not knowing they're pregnant until they're 7 months.
Seven, imagine this. We require mothers to have 4 prenatal visits. What do mothers think in between? They need someone to talk to between those periods, but they have only 4 visits, at least 4 visits. If they wanted more, they have to fall in line because the others have to complete 4 visits.
So when we talk about, let's say, making every birth count, making every birth a safer birth, what are the concrete manifestations that we need to achieve this? Apart from what's already being done, what do you think we need to make it even better?
Okay. We have to address the 3 delays.
Yes.
So mothers should get the right information. They should have access to information because their health-seeking behavior is the first step. If mothers don't know exactly what's wrong with them or what they have to do, and you cannot second guess it because it's 2 persons right away. It's the mother and the child. And I know Rika and Dr. Ligia will talk about this later. I don't want to give everything about this thing, but at the DOH, we wanted to make sure that the health-seeking behavior is really there because it starts with mothers. Even if we build health facilities, if you are not coming to us, what's the use of our health facilities? Even if we have doctors, we spend on treatment, even if we make sure that the services will be offered, if you don't come to us, so what do we do? Sometimes we take plans of going to them, especially in geographically isolated and disadvantaged areas where there are no health facilities. So the only option for the Department of Health is to make sure we send teams so that the households are visited. But this is not every day. Probably they're lucky if it's once a month. But you cannot time your pregnancy. And so therefore, they need other options.
So, what are the policies now that DOH is really pushing forward to help make this happen?
Oh, we're so happy because President Duterte in his SONA just mentioned full implementation of the RH law, the reproductive health law. And we're happy about this because this is very, very important. Local governments have to toe the line, and local governments will have to work with the Department of Health so that we build facilities, we are able to build their capacity to provide these services. But of course, we want more. We want to make sure that every mother gets the services they need. We're not looking at, Stephanie, about making arrangements for these services. If I have to share a story, because I know you have many women stories. I got a call, and she said she wanted to have a prenatal visit. I said, good. So I referred it to a hospital, and I came back to her and I said, how was it? Oh, doctor, I'm still here in the hospital. Why? What time did you arrive there? I was here at 5:30 in the morning, and it's already 5:30 p.m. And it's her first prenatal visit. And she needs 3 more. So the experience was not comfortable. And I said to myself, well, the second, third, and fourth, I don't think. Yes, but I made sure that I talked to her that although it was not very convenient for her, she really has to do it. But I cannot remind her every day. So that's the sad story. Who can remind her every day that she has to do these things?
So, you mentioned earlier we have partnerships, right, with private corporations, the private sector. Could this be an opportunity to help remind these women about this or help provide the information?
That's the main reason I'm here. I'm expecting more from Rosh and her team. That's the only reason I said yes. Okay. Because they are offering an innovation. I don't want to spill the thing. And I'm sure the Department of Health is very interested about this innovation. But I also have my personal concerns. But let's not spill the bean. But the private sector can help us in our pursuit for making arrangements. It's not acceptable for the Department of, for example, that you turn away mothers just because they cannot pay, just because it doesn't allow you to get your profits. But I know the private sector is aligned with us, and our Secretary of Health, Secretary Ubiel, is looking forward to working with them and working with you for this project so that we can make a change that's going to benefit many mothers in our country.
Thank you so much, Dr. Tayag. And on that note, I'd like to remind all of you that the media is also a big part of making this change. So please spread the word about what's happening today, and we'll continue to learn more about this topic with Dr. Blanca de Dia. But thank you again. I know it was also difficult to get here today. First, there are some topics here about pregnancy risks, as your expertise in gynecology, I want to know whether the pregnancy risks that a lot of Filipino mothers really need to know and above all understand, right?
Okay, good morning everyone. I guess I am the obstetrician gynecologist in this room. I'm really very happy to be part of this consortium because it's a consortium of the government, it's a consortium of the health providers, and together with this FWD, it is a very good opportunity to educate our mothers. It's really very sad when the mothers or any patient will tell you, Doktor, ikaw na po ang bahala sa akin. You know, there are things that as patients they should know because it's very important. Because we're not, as doctors, we're not always with the mothers or their babies. So it's very important for really patients to understand what's in for them. Now, you're asking me about the risk. You know, when patients tell me, Doktora, cesarean ba ako? I tell them, alam mo, most of the time you'll have a normal delivery. But there are some risks and complications that you ought to know. One of them, I'll name a few, for example, like abortion, which everybody knows, it's miscarriage. And then ectopic pregnancy, when your pregnancy is outside the uterus, it's life-threatening. Thirdly, if you have very common nowadays, is premature delivery. Because of the stress of the traffic, the stress of the, you know, everything, road rage, and of course, finances, then that's one, premature. But you have also other things like hypertension, diabetes, and when you're already in labor, you have to have sometimes you have the problem of abnormal presentation and abnormal labor and fetal distress, and of course, hemorrhage after delivery. That's why it's very important for pregnant patients to be able to have a prenatal checkup, as what Dr. Tayeb told us.
To be armed with that information. And from what I gather, I think most people think, you know, when you're pregnant, it's always the baby, the baby, the baby. But the mother is just as important as the baby, and all those risks are also to the mother because they're linked, you know, even when you give birth. I mean, you're so crucial to your newborn, right? So that's a very interesting thing I think people need to understand. Okay, since expectant parents consult and rely on their doctors for the health of both moms and babies, what can medical practitioners do to help them prepare and ensure that, you know, they will be at their best of health at the most crucial time?
Of course, the first things that when a patient, for example, or a pregnant mother visits the doctor,